my name is Steph Castile, and I'm an ADN student at Wilson State College, and today I'm going to be demonstrating getting blood from Essential Line, changing Essential Line dressing, and administering medication from Essential Line. So I'm in the med room, I've received doctor's orders, and I'm going to go over them with the MAR. And so I have Chester Chest, date of birth 7/19/19, and he's allergic to codeine. And so the orders are: give all IV medications in the Central Line, use the port for all blood draws, Central Line dressing, change every 7 days in PRN, that is today. And I have ceftriaxone 1 gram, IV push, ceftriaxone 1 gram, IV push, Q8 hours. And flush Essential Line with heparin, and this is the heparin. And I'm going to go ahead and do hand hygiene and put on gloves to get my medications. And so these have already been pre-done for me. And I'm going to check them with the MAR. And I have ceftriaxone 1 gram. And it is, I checked the expiration date and it's not expired and it's clear. And then I have the heparin, 500 units, 5 mils. And I've checked the expiration date and it's not expired and it's clear. And I need to verify this with the second nurse, and she nodded that it's all good. And I'm gonna leave my gloves on for video purposes, but take them off, hand hygiene, go to my patient's room. Knock, knock. Close the door for privacy. Hey Chester, I'm Steph, I'm your nurse today, and I got some doctor's orders. And I'm going to be taking some blood out of your Central Line. I'm going to change your dressing around your Central Line. And then I have some medication to administer to you. Is that okay? All right. So I need you to verify your name and date of birth. Chest to chest, 7/19/19. Perfect. How are you feeling today? Yeah, well, I hope you feel better. So I'm going to do hand hygiene, put on new gloves. And I'm going to go ahead and if this line was hooked up to IV pole and getting infused, I would take it off and wait 10 minutes before I did the blood. And it isn't, so we're going to continue forward. So I'm going to take this. I'm going to clean this 10 to 15 seconds. And I'm going to go ahead and hook a flush up. I'm going to unclamp this. I'm going to pull back, checking for patency and blood coming back into the line. I want to make sure it doesn't go into the port. And so I'm going to flush using a push-pause method. You doing okay, Chester? Good. I'm going to go ahead and check the IV, and it's doing okay. I mean Central Line, not IV. Okay. And now I'm going to go ahead and not disconnect this, and I'm going to go ahead and pull back. 10 cc's, and I'm going to clamp this. And I'm going to go ahead and discard this blood into the sharps container. And then I'm going to hook up this, unclamp. And I'm going to pull back. 10 cc's, clamp, and unhook, and I'm going to give this to the lab or phlebotomist that's available to take down to lab. And then I am going to unclamp, and I'm going to go ahead and flush with the push pause method. How you doing, Chester? Good? Okay. Perfect. All right. And so now we're going to go ahead and do the dressing change. And so I have my supplies here. And I'm going to go ahead and switch gloves, do hand hygiene, new gloves on. And so I'm going to go ahead and check this. There's no red. It looks pretty good. And so I'm going to do this. And good grief, this is sticky stuff. Okay. Sorry about that, Chester. Alcohol will help get this off. I want to make sure that I get all the edges up. This is some sticky stuff. Sorry about this, Chester. Gosh darn it. Oh. Okay. I'm going to make sure and hold this down. Okay. And that's still painted in there. Okay, it looks pretty good. At this time, I'm going to take my gloves off. Perform hand hygiene, and this is closed, and so it's not expired or anything, not been tampered with. So I'm going to go ahead and open it, and at this time I'm going to go ahead and grab the mask, and Chester, I'm going to go ahead and put this on you, and I'm going to have you turn your head to the right while I change the dressing on your central line. And then I'm going to, okay. Okay, I'm gonna go ahead and grab this here. Boy. All right. And then I'm going to take this. At this time, I'm going to make my left non-dominant hand my not sterile hand anymore. There they go. And I'm gonna go make sure that this doesn't come out. Make sure I go around the edges and kind of twirl this away from me so it grabs the little particles on there. And then I'm going to grab this and put it here. And I'm going to go ahead and put this down. This down. All right, Chester. On this, I'm going to make sure I put my initials and date and time. How's that feel, Chester? Doing okay? All right. I'm going to go ahead and get rid of all of this. Take my gloves off. Do hand hygiene. And now I'm gonna don gloves. Oh, here, Chester, yes, you could take that off too. And now, Chester, I'm gonna go ahead and administer your medication. And so I'm gonna check this with the MAR. And so we've got the ceftriaxone, 1 gram. And then the heparin, 500 units per 5 mils. And I've already checked this with my second nurse. And it's all good, so. I'll go ahead and clean this. 15 seconds. I'm going to go ahead and flush and clamp and pull back. And there's a little bit of blood. So it's patent, and we're going to go ahead and use this doing the push pause method. Close this. Get the air out. Put the ceftriaxone on. Undo that. And then we're going to go ahead and push this over 2 to 3 minutes. For video purposes, I'm just going to keep going with the push pause method. How are you feeling, Chester? Okay. Now I'm going to make sure that I check to see if there's any anaphylactic reaction. And he's doing okay right now. I'll go ahead and clamp this. And I'm going to flush. Again, using the push pause method. You feeling okay? I know, I hope this medication makes you feel better. Okay, go ahead and clamp that. All right, Chester, now I have your heparin. And this is to make sure no clots form at the end of your line. And just help with patency of your line. Okay. How's that feel going in? Okay, good. I don't want there to be any burning or pain. If you push this too fast, there can be a lot of pain. And so I'm going to go ahead and clamp this, and we don't flush after this. And so I will go ahead and stay with Chester, go ahead and document how the line was, how he took the medication, the blood, and the changing of the dressing. And that's it.